Welcome to an hour of HealthMade Radio. HealthMade is a community for natural health seekers where we educate people about common health conditions and share extensive research on the most effective natural health treatments and promote legislation that protects our health freedoms. A core concept belief is in the innate intelligence and healing power of the body, and if properly supported spiritually, emotionally, and nutritionally, it can find its way back to health. HealthMade Radio will bring you information from integrative health experts throughout the world. Check us out at healthmade.co. Health is what you make it. I'm Dr. Michael Karlfeldt, and I will be your host. Today's guest is Dr. Dominik Nischwitz. Dr. Dominik Nischwitz is a specialist in biological dentistry and ceramic implants, functional medicine practitioner, one of the world's leading biohackers, and current vice president of the ISMI, International Society of Metal-Free Implantology. With his father, Dr. Nischwitz co-founded DNA Health, an aesthetic center for biological dentistry in Tübingen, Germany, in 2015. Dr. Nischwitz has exclusively used ceramic implants since 2013, placing more than 4,000 to date. A pioneer in the field of holistic dentistry, Dr. Nischwitz regularly gives lectures around the world and has recently published his first book, It's All in Your Mouth, at Chelsea Green. He trains traditional dentists in biological dentistry and believes that all health starts in the mouth. Dr. Nischwitz, it's such a pleasure to have you on the show to discuss such a very important topic.
Thank you very much for having me. It's a pleasure.
So tell me a little bit, what brought you into biological dentistry, and how is that different than normal dentistry?
So my definition for biological dentistry is more like the next level of traditional or conventional dentistry. It is the overlap of high-tech dentistry, functional medicine, and health optimization, biohacking. And the goal is basically optimal health. And as you already said, I do believe that all health starts in the mouth. And this all started for me about half my life ago, about 19 years ago, with lots of various problems, like health problems for my body. And this was right around when I started university. So I was just trained as a conventional dentist, and at university, I was, I had an assistancy, it's called an assistant doctor, at a surgeon because I wanted to be an oral surgeon. And he was still doing amalgam fillings. And I was very much interested in fitness, bodybuilding, and all these things during my studies, and was learning about nutrition extensively, about supplements. And these amalgam fillings, like you commonly refer them to as silver fillings in the US, they caught my attention because I just found them ugly back then. And I knew my dad, who was also a dentist, he wasn't doing these silver fillings ever since the 1990s. And I somewhat knew that they are also not healthy. I didn't really know why, because we didn't learn it in university. But I had to look it up because I told my boss, I'm not going to do this. And this is when the whole universe opened up for me when it comes to, health starting in your mouth, and that I was able to really see another level. This was the part that I was always missing in university, and this was that I can help patients become really healthy and not just fix teeth and pain and aesthetics maybe. This is how it all started. And from there, I got addicted.
Yes. So you used the word biohacking. What does that mean?
So biohacking is maybe that's what the cool kids nowadays do. So it's more referred to maybe as self-optimization, or I like the word health optimization / biohacking, because this is what we basically do. We look for tools and strategies on how to improve the body's energy level, the sleep stages. We use nature for grounding and all these things. Basically, how can we fine-tune our biology in this more unnatural, not so natural world, like that our epigenetics work better here. Biohacking is more like what the cool kids do. So I was never referring myself to being a biohacker, but it became a bit more popular. And I think it's just this search for a better life, better body, and more optimal health life.
Yeah, perfect. And so you were talking about then silver fillings, and I mean it caught your eye. I mean, one, your father did not do them for quite some time, and also they were ugly, which I think they are as well. But are there other reasons why you should not have silver fillings in your mouth?
Yes. So besides being ugly, I found out back then that 50% of the silver filling is basically mercury. And mercury is the most toxic non-radioactive element known to men. And I knew then that if I remove it from a patient's mouth, a silver filling, the amalgam filling, that a company comes in and grabs it as highly toxic waste. And I was thinking, wait a second, how am I able to remove this material as highly toxic health waste, hazard, and place it at the same time in the mouth of my patients? That's not possible. So I told my boss, no, I can't do that. And then I looked at how I researched basically everything about amalgam, about mercury. There's tons of research out there, and good integrative medicine doctors from Germany, Dr. Dietrich Klinghardt or Joachim Mutter, who are doing research for already 30 years, and mainly about these heavy metals that you find in these amalgam silver fillings. Mercury, already said it, but there's also tin and a bit of silver and other things in it. And if you know that this stuff, like mercury vapor, will come out of this little filling every day as a gas. Mercury vapor is the problem, Hg0, and that's about 2 to 3 micrograms, so millions of a gram, so not visible, odorless, but this stuff will chronically intoxicate you as a patient because it's not tightly bound. It gets out of the filling by grinding, by chewing, by brushing, by let's say acidic foods, acidic drinks, whatever. You will take a little bit more mercury into your body, as you should, because mercury has no place in your body at all. It is a neurotoxin. And the main source for mercury, besides obviously the environment, but the main source is still the silver filling for mercury intoxication in your body. So this is basically why I couldn't do it anymore. And because my focus was always, how can I make my patients healthier, really as much as possible, I obviously looked for better solutions.
So this mercury, when it's coming out, I mean, you say that it's neurotoxic. So what kind of symptoms would an individual look for that would then indicate that maybe they are dealing with this kind of toxicity from mercury?
The problem here is, and maybe you heard of the Mad Hatter disease, mercury is known to be kind of like a masquerader because it could elevate or aggravate every symptom known to man. So it's really hard to grasp, but being a neurotoxin, it obviously affects neuroplasticity, it affects your ability to think, maybe your short-term memories. So if you just go down the brain route, and just basically maybe makes you a little bit more slow. It also is connected to various sorts of autoimmune diseases like multiple sclerosis and Parkinson's disease, even ALS. So you find research connecting heavy metals, or especially mercury, basically all sorts of disease, skin rashes, depression, mood disorders, irritable bowel syndrome, chronic fatigue. So you could basically, or Hashimoto's, autoimmune diseases. Basically, you could say every disease, and then you will find something about mercury. So it's basically just, mercury is probably not the main or the holy grail for all disease, but it's the most toxic non-radioactive element known to man. Why would you place it in the mouth of anybody? So this is the question I would ask. Are there better solutions? Because, your body has to deal with it, and obviously a toxin is always dose dependent. But if one molecule already is able to destroy your nerves in a experiment, then why risk it?
Yeah, I couldn't agree more. We're going to take a quick break. I'm Dr. Michael Karlfeldt. You're listening to Health Made Radio. I'm here with Dr. Dominik Nischwitz. He is the author of It's All in Your Mouth. We'll be right back. Welcome back to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Dominik Nischwitz. He is a biological dentist and also specializes in ceramic implants, functional medicine practitioner, and one of the world's leading biohackers. So we're talking about then it seemed like mercury had just a huge amount of impact on the body. And you said that even just one molecule can destroy a nerve. And so that would then make sense that it can then be a strong factor in things like dementia or Alzheimer's disease or neurological conditions like Parkinson's or MS or ALS and those type of things. But then you're also talking about kind of immunological reactions. I mean, immune system reactions like autoimmune diseases. You were talking about Crohn's and Hashimoto's. So how is that? How does that work?
So autoimmune disease is just this concept that your body or your immune system gets intolerant to its own tissue. And from a naturopathic point of view, this makes no sense because your body is not stupid. Your body or your immune system knows exactly how the body looks like. But if the cells look different, let's just make it easy for the audience maybe, there's something called a haptene, which means if, let's say, a mercury gets oxidized by catalases and connects to a thyroid cell in your body, then suddenly the thyroid cell doesn't look exactly like it should be. And the major histocompatibility complex of your immune system does recognize it as wrong. And this could be the start for, let's say, your body or your immune system attacking your thyroid. Not always just the mercury, but it could be one of these factors. Same holds true for MS. MS is also an autoimmune disease, multiple sclerosis, where your body or your immune system falsely attacks the myelin surrounding your nerves. And there are studies or research showing that you can get allergic, or your body can get allergic to compounds. Like your body knows exactly how the myelin, so the sheeting around your nerves, looks like. But you can make tests, an ELISA test, to myelin plus cadmium or myelin mercury. That is a chemical bound then. So your body could be allergic to a myelin mercury compound and then attacks the myelin. So there would be a combination, or there would be an entry point for another autoimmune problem. Also, obviously, a mercury is a strong antibiotic, and it kills bacteria. And if you swallow it all the time, then you also it also leads to dysbiosis in your mouth, but also further down in your gut, which is also connected to immunological problems, disrupting your microbiome was never a good idea. And the entrance to your whole gut system is your mouth.
Yeah, exactly. Yeah, so I mean, it does make sense. I mean, if you have it in your mouth and you have these these vapors are continually being released every time you chew or you drink something warm. And, obviously these vapors can then go up into the brain easily and hit the neurological system there. And then as you swallow it, then it will then impact the lining of the intestinal lining to trigger inflammation and then causing the immune system then to go after these compounds, like you're saying, when mercury binds to healthy tissue, it becomes a compound that the body doesn't recognize, and the immune system start to go after that. So, yeah, that absolutely makes sense. So it isn't there also, so now we're talking of mercury, but then we have other things like gold, and I mean, aren't there other metals as well, and do they have an impact as well?
Yes, so metals, I've always break it down into three, let's say, challenges for metals or metal-related challenges. So we already talked about the toxicity of a material, because mercury obviously is the most toxic one that's getting installed, but there's also gold that could be toxic, silver, tin, basically all the heavy metals or all the metals that we use to repair things in your mouth. They're not supposed to be in your body. That's it. Then secondly, there's the immunological problem. You can become allergic to almost everything. The most common allergen when it comes to metals is nickel. But there's research showing if you do an LTT, lymphocyte transformation test, and there's a big, let's say, a cohort study where they did about 1,300 patients and checked it. So right after nickel was organic and inorganic mercury, and on the fourth place, so to speak, was gold already, and tin, copper, and all the other metals. So if your immune system gets allergic, it's really a problem, because then it's not dose dependent anymore. That means you could be, the toxicity of the mercury, or let's say silver, is maybe not as big, but if one molecule already activates your immune system, you're getting a skin rash or whatever, let's say an inflammatory response every single time, kind of like being a celiac patient. So the immunological component is really a big one. And the third component, or the third challenge, is always the electric component. And by that I mean every metal in your body or in your mouth will act like a small antenna in this new world where there's everywhere Wi-Fi, 3G, 4G, 5G, commonly referred to as EMF or electromagnetic field. And there's also research showing that you just have if you do a phone call on your cell phone with having a silver filling in your mouth, the electromagnetic waves that normally go to the cell phone and the cell tower back to the cell phone tower, they will go to your filling and release more mercury vapor while you're on the phone call, for example. And also various other metals have been studied in your mouth, that if you just, again, do a phone call, that, for example, a titanium implant will heat up to 4 degrees Celsius, which is high fever, which melts the surrounding bone, so to speak, but also just is an amplifier of these waves up until 400 to 700 fold. And if you know that your body is electric too, and you have a whole nervous system that is kind of like a current, then obviously you have an interference there. So the electric component, even if the toxic part wouldn't be a problem and you wouldn't be having an immune problem, you still have Wi-Fi, 3G, 4G, 5G, and therefore little antennas in your mouth. Was different 20 years ago, but nowadays you cannot tolerate. If you want to be optimal healthy, metals in your body, especially in your mouth, which is so close to your brain, is a bad idea. And luckily, we have better solutions that are more neutral and, not little antennas.
Yeah. So that if you have that mercury then in the brain, and like you're saying, it mercury or heavy metals in themselves will conduct electricity. So, and obviously neural function is based upon electrical activity. So if you're then creating all this interference, no wonder people are we're seeing more ADD, ADHD, autism, those type of diseases where, that involves our ability to concentrate and focus, and also things like depression and anxiety, where you're creating a kind of dysfunction in how our thinking pattern and how we, secrete neurotransmitters and so forth.
Yeah, that's perfect. Exactly. And therefore, not a good idea nowadays to have the metals in your mouth or in your body elsewhere.
No, exactly. Well, let's take a quick break. You're listening to Health Made Radio. I'm here with Dr. Dominik Nischwitz. He is the author of It's All in Your Mouth. We'll be right back. Welcome back to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Dominik Nischwitz. He is the author of It's All in Your Mouth. He is one of the world's leading biohackers. He's a specialist in biological dentistry. There's so much ground that I want to cover in regards to the mouth, but I wanted to just go into, so you have people that understand that I should not have the silver filling in my mouth, that is bad for me. Can you just go to any dentist just to remove that silver filling? Is that a good idea?
No. No, this is obviously a bad idea. So you have to be really trained to know how to remove these silver amalgam fillings properly. Because of the mercury content, 50% of it is mercury. And did you know that they used it on purpose, the word silver, in comparison to gold filling, just as the cheaper alternative, kind of like a big marketing tool, and never really talked about the mercury in it ever since 2018, when there was the Minamata Convention. They started to talk about that there really is mercury in these fillings. And if you know how dentists will drill out a regular filling, you will aggravate or like just by drilling out the mercury filling, you will release way more mercury vapor, and also obviously mercury and heavy metal particles by just swallowing them, as you would have had by just having the silver amalgam in your mouth. That's about 2 to 3 micrograms of vapor per day. Whereas when you drill it just out without any protection, I don't even know how much it is. It's the whole filling then. And you probably, if you have seen this once, how you drill it out without protection, you will never get rid of this stuff. It will be in your whole system, not just the vapor, but also the particles will probably be somewhere leaching into your whole gut lining and wherever. So it's really critical that you find somebody who will remove mercury or silver filling under safe protection measurements. In the U.S., there is the IAOMT, the Certified Dentist, Biological Dentist, with the so-called, I think they call it actually SAFE protocol. We train dentists in Germany or everywhere to become specialists in biological dentistry and ceramic implants. We train them, obviously, how to remove the fillings, the amalgam, but also all metal fillings safely to protect the patient, but also, very, very important, to protect ourselves as a dentist and obviously our nurses, because we will maybe do this every day for 5 years, 10 years, 20 years. So the dentist itself is the one who is the most intoxicating themselves because of these multiple drillings, whereas the patient only has like a few fillings. So it's really important on all sides that you know how to remove amalgam fillings safe. Otherwise, don't do it.
And so, and I have patients, they come to me and they've had the silver filling removed, and then I ask them, if it's somebody that is competent in doing that and trained in doing that, and then they make the comment that he was using a dam and then the suction and thinking that is enough of a protection. And is that correct?
No, it's actually wrong, because the rubber dam is just, basically the rubber dam is only there to protect particles from like getting swallowed. But the rubber dam doesn't protect you against the vapor at all, and the suction obviously also not. And I have seen the most problems happening for patients after removing their amalgams without protection. So many patients with chronic disease came in and said, oh, it basically all started when I had my amalgams removed. I thought I'm going to do something good for my body, but actually everything got worse ever since then, and I can't focus anymore, or I have this and this problem. So it's really critical. And I can tell you what we do. We do the rubber dam, of course, because we don't want to swallow anything. Then we have a device that we put on top of our dental suction. It is called a clean-up suction, and it was actually invented by the Swedish. So a good thing. It's basically going over your tooth and has more like an under suction or like a bigger suction. It's more rotating in there. Then we will also have a machine. It's basically an air purifying system. It's called the IQ Air, and I'm not affiliated or anything. I'm just saying what we use. It's kind of like a big oven. Looks like a big oven tube that you place in front of your patient's mouth and close by, and it has a big diameter, about 10 centimeters. And it sucks up to 99.9% of the mercury vapor, which is really good. It's a loud device. It's really strong, but obviously helps a lot. Then we also try to not drill the filling at all, but go around it and break it out if possible. Obviously, that's only possible with bigger fillings because we don't want to hurt the tooth. So tiny filling we need to drill. But a big one that maybe will later be a partial crown, we can maybe just break it out. It will be best because we don't produce any vapor at all. Then the patient has a nasal probe, which contains pure air, that nothing gets more oxidized. Also have the patient close their eyes or get them some glasses. We as dentists, we will wear on top of the IQ Air purifier, have a FFP3 mask to protect ourselves and our nurses. And we will also run a vitamin IV during and before and after the removal, just to help with keeping the immune system calm. High vitamin C, magnesium, various other things. And what we also do when the amalgam is removed, we place a little bit of chlorella, which is a algae known to bind heavy metals. We place a little bit of chlorella paste into the cavities and leave it there for, let's say, 2 to 3 minutes to get as much of the mercury vapor out of the dentin tubules. And then we most likely won't even do a permanent crown, but just a temporary filling made out of Latin cement, just to let your teeth, let's say, breathe or further detox and help them relax a little bit before we use any composites or ceramic inlays or whatever, if possible. So also, obviously,
Go ahead.
Do you hear me? Oh, yeah.
Yes,
we
go
also
ahead.
prepare our patients with the right nutrition, with the right supplements, with the right protocols to upregulate liver phase 1 and 2 or balance it, get enough binders on board, front load with amino acids, enough protein, and various other things. We check for detoxification, SNPs, and pathways, and also tell them what to do for the next couple of months to really help their patients, help their bodies get rid of all these things. And also use, if necessary, at a later point of time, chelation with various environmental doctors, and really try to measure everything. So what gets measured gets managed, and we also use this in terms of functional medicine to really help the body or the patient's body to get to optimal health. You know that health in the medical field is more like absence of disease, but we're really interested in getting to the next level. That's why I don't only have chronic sick patients. Let's say 10 years ago, it was really like we only had very, very sick patients. But because of this world evolving in terms of functional medicine or health optimization, there are way more people coming in that are more health aware now that look for the edge, like high performance athletes, but also just normal people that think something is not optimal and they just want to, get better. And finally, they're learning that a big foundation to all the functional medicine and problems that everybody's already talking about is actually the mouth as the entrance to your body. It's huge and nobody talks about it. That's why I make the effort to really get it into the brains of my peers or equals in the field of functional medicine, and that we start teaching this on a big level to help as many people as possible getting to optimal health, because we're living in an epidemic of chronic disease, and 60% estimated are starting in your mouth by maybe some old stuff. It's not just the metals, it's also the root canals, it's the cavitations, it's all the other things that we used to do to just repair, because that's how we trained as traditional dentists. Repair.
I'd like to get into talking a little bit about root canals, because that's such an important subject. And we're going to take a quick break. You're listening to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Dominik Nischwitz. We'll be right back. Welcome back to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Dominik Nischwitz. He is the author of It's All in Your Mouth. He specializes in biological dentistry. He is the current vice president of International Society of Metal-Free Implantology. So you're talking about, you're saying like 60% of all diseases starts in the mouth. And I mean, that's a staggering amount of diseases. And so going then to things like hidden infections and also root canals. I mean, there's been studies showing that there's really no root canal that is not infected. So how do we go about dealing with, when you need a root canal, what do you do to prevent that?
Yes. So first of all, get healthy as possible and don't ever need a root canal, because root canal basically is a pain treatment that we need to do when you had a decay that's getting close to your nerve and bacteria invade your nerve, and then you have massive pain because your tooth is dying. So this is why the root canal basically was invented as an acute pain treatment, but it evolved into a big, let's not say moneymaker, but it is a big. Some dentists only do root canals, like endodontologists. They're called. They only do this, and it's called conservative dentistry. By that they mean they conserve your tooth just for biting issues. And it's possible. If you do a root canal, the pain is gone. You can do a cap on top of this tooth, and it will last a lifetime, and you can bite on it. But as you already said, that's correct. There's almost no root canal. If you look at it from a three-dimensional point of view, from a cone beam, 3D X-ray, cone beam CT, then most of these teeth have some sort of chronic infection on the tip of it. Why? Because it's that material. The tooth is a organ. The tooth is not just some hard thing that you can bite on. It's kind of like an extension of your brain, like your eyes. It is really a fascinating organ. It is hard as stone, and at the same time, it is so sensitive that you can feel a hair with it. And it has a blood supply, it has a lymph supply, and an autonomic nervous system. And when it dies or when it hurts, you get a decay. What the dentist does is just taking out, let's say, the life of the tooth. Like the big channels in the tooth will be cleaned, the pulp will be taken away, so there's basically no more vitality in this tooth, leaving it a dead organic part. And then we place some materials in there you could be allergic to, or it's kind of like plastic that you put in these teeth just to keep it there. The problem is, if you look at a root canal, if you look at a tooth from a microscopic point of view, then and we look at the anatomy, the tiny anatomy, the tooth is made out of not just these thick channels, of pulp, but also from little tiny dentin tubules. And you find about 30 to 75,000 dentin tubules per square millimeter in such a tooth. So if you add all these dentin tubules just from one root, then you come up with like 1 kilometer of length, which is about, let's say, 0.6 miles. I hope that's correct. In just one root. So let's see, a molar tooth, like a back tooth, has about 3 roots. So that's about 3 kilometers. And these little dentin tubules are a perfect cave for bacteria. And because there's no more immune system, because this tooth is dead, there is now the perfect case for the microorganisms, mainly the anaerobics that get in there, like fecal bacteria they find in there, like tons of they found 78 different species in these root canals. Some they don't even know, and a few of them go straight to the heart and make problems there. And yeah, they can live there without the immune system because the body, obviously, the immune system is too big. And you can see that the macrophages, which is the innate immune system, which basically produces inflammation, tries to help against these bacteria by producing a low-dose chronic inflammation around the tip of the tooth, which you can see as a dentist on the X-ray as a little cyst or bigger cyst or just a periodontal apical periodontitis, like a bigger bigger ligament space on an X-ray. So just for the imagination, see the bacteria as the mouse that lives in these tiny tubules and is polymorph and can change size and shape and just lives in there. There's nice pictures showing this. And see the macrophages as a cat around the cave, cannot do anything besides staying there, waiting there, and producing granulomatous tissue like cysts, or even the other option your body has besides building a inflammation or cyst is making the bone surrounding this tooth hard as stone, which is called ankylotic. So they basically, the bone and the teeth kind of like grow together, which means the body builds a new outside wall. I hope that was quite understandable. And also bacteria, if they live in these teeth, that's a chronic infection. Your immune system does a chronic inflammation, but also the bacteria obviously have their byproducts or their metabolism, and then they produce highly toxic sulfur compounds. They are called cyrether or mercaptanes, that's sulfur compounds, which in high dosage are really, really toxic. But again, it's kind of like with the mercury. They are toxic in itself, and your body has to deal with it. Your body is probably able to compensate for it, but it costs energy, and your liver, over time, maybe gets too stressed out, and you're getting more and more toxic. Also, a tooth or something that is dead in your body, imagine a black finger or a black diabetic foot. Every medical department will directly remove this foot because it's pretty clear that within a minute, all the bacteria and all the byproducts spread into the whole system. But a tooth, nobody sees. It sticks in your gum, in the middle of your jaw. Nobody sees it. You can put a cap on top. They look like black rotten teeth. They smell like that, but you can't see it, so you don't know. And these byproducts, if you have like, let's say, dying organic material in your mouth, are called putrescines and cadaverines, and they are in itself, again, super toxic. And also, like with the metals, your body can become allergic to these styreters, to these mercaptanes, but also to the putrescines. So it's, again, toxicity, it's infection, and it is also byproducts and immunological problems. So not a good idea from an overall health optimization point of view to keep a dead organ in your body. It was never a good idea to do this. So why would you do it in your mouth?
Yeah, so what should one do? Because, I mean, sometimes you need a solution. You're dealing with pain, and it's infected all the way down. So what should a person do? What is a good alternative?
No, it's actually good. Go to the dentist, do a root canal. You have to know, and this is how we treat it, if you have the pain, we need a pain treatment because it's massive pain. You cannot stand. Go there, let the dentist take care of the infection, but know that this root canal or the initial root canal treatment is only a temporary solution to get you out of pain and to think about a nice long-term strategy for your overall health. And this is where my specialty comes in. Luckily, and I was searching this for the whole biological dentistry concept. I was searching as a surgeon. I was searching for a compatible solutions for these root canals. I knew already that titanium is not on the cards anymore because it's again a metal. So luckily, I'm doing ceramic implants ever since 10 years, and now they're so good that we're able to do, let's say, in 90% of all cases. If you come in with the root canal, I will remove it very, very gently, clean everything. We use ozone, whatever necessary to help get the infection away. And then, if possible, if the bone is still there and everything is healthy, we are able to place a ceramic implant, which is a total neutral biocompatible solution, into the socket, kind of like a plug, and let it osseointegrate at the same time as your body heals from taking out the tooth. So this is like a double whammy in terms of healing, because obviously the focus one is how to get this root canal out of your body and clean the socket and make everything healthy. But also, if you know dentistry, or if you know what happens if you remove a tooth, when you remove a tooth or root canal tooth and you don't have a solution, then what happens within the next three months is called alveolar atrophy. That means the whole bone where the tooth was sticking into will shrink. That's just normal. But if you're able to place a ceramic implant, which is totally neutral, your body grows on top of it. And that's why we call it bone-growing implants. And it's really a nice strategy. Also, you basically never have a surgery. You just remove the tooth, clean everything, disinfect everything, and then place the ceramic implant. Obviously, that's a fine motor skills, high-tech dentistry technique, but it's something you can learn as a dentist and help your patients dramatically. And if it's a front tooth, for example, one of your incisors, you don't want to run around with the gap. We will already place a temporary on top and nobody sees it. So it's really finally a solution there that you can do for the long term, which saves time, which saves pain, which also probably saves money. Obviously, the best strategy is to never lose a tooth and keep it healthy. But if this ship has sailed, there is a solution, a biocompatible one, called immediate ceramic implant.
Oh, it's perfect. And I know, I mean, there's so much to know, and that's why I'm so glad you wrote your book, It's All in Your Mouth, because, I mean, like you're saying, the best solution is to not have to have these things as solutions, and that is to take care of your health, using, what kind of micronutrients to do, how to take care of your health, through biohacking or optimization of your health. And I know that you have all that good information, and it's all in your mouth. So, Dr. Nischwitz, it has been such a pleasure to have you on the show, and thank you so much for bringing forth this very important information to help people with chronic disease. I mean, that, like you said, it's 60% of your health starts in your mouth.
Yes. Thank you very much for having me. It was a pleasure, and I hope many people can hear this and find solutions to upgrade and get to the next level of overall health optimization.
Wonderful. Well, that is it for today. You're listening to Health Made Radio. Remember, check us out at healthmade.co. Health is what you make it. 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 Is what you make it.